Good afternoon, everyone. This is Dr. Moreau with Causally Call. As you know, every Sunday at 3 p.m., I'm live with you to provide you information. And we believe that the more informed you are, you'll be able to make better decisions. So, as always, I'm going to send our invite to our friends so that way they can watch us lives. And we also hope that they will share this live with their friends so they can also benefit from this invaluable presentation. So I'm going to go ahead and invite a few more. And then we'll begin with today's presentation. Okay, I'm about to be done. All right, so today's presentation is very interesting. As you know, I've been doing a series on personality disorders. And today we're going to talk about narcissistic personality disorder. But before I began, we spoke about antisocial personality, avoidant, borderline dependent, and last week we spoke about histrionic personality disorder. So if you miss any of these presentations, you can go back and watch those videos so you can benefit from this information. So today we're going to talk about a narcissistic personality disorder. So what is it? What are the symptoms? What are the causes of it? How do you get a diagnosis? And whether or not there's any treatment for this type of personality disorder. So this is a very vast personality disorder. So I'm really going to focus on the symptoms, the causes, and the treatment. And there are other aspects of it that I will not touch today. So what is it? What is narcissistic personality disorder? So it's basically a mental health condition. It affects a person's sense of self-esteem, identity, and how they treat themselves and others. So it's more than arrogance or selfishness. So it is a mental health condition. So people with narcissistic personality disorder, so we're going to refer to it as NPD. So people with NPD may struggle with feelings of failure or rejection. They struggle with feelings of failure or rejection. So what are the symptoms? There are many symptoms that we are going to go over. So you may identify yourselves with these symptoms, or you may know somebody who you can identify with having these symptoms of NPD. So what are the symptoms? So the symptoms revolve around thoughts, feelings, and actions. So a grandiose sense of self-importance. So this is when you overestimate it. They overestimate their capabilities. They hold themselves to unreasonably high standards. They brag or they exaggerate their achievements. So they brag or exaggerate their achievement. So that's one symptoms. So the next symptoms, frequent fantasies about having or deserving success, power, intelligence, beauty, love, or self-fulfillment. So they fantasize about having or deserving those things. Number 3, belief in superiority. They think they are special or unique. They believe they should associate only with people who are worthy with people they see as worthy. So they want to associate themselves with people they see as worthy. Another symptom is need for admiration. They are fragile. They have fragile self-esteem, frequent self-doubt, self-criticism, or emptiness. They have preoccupation with knowing what others think of themselves. And then they fish for compliments, right? So they fish for compliments. Number 5, entitlement. They have inflated sense of self-worth. They expect favorable treatment. They are angry when people don't cater to them or appease them. They get angry. Number 6, willingness to exploit others. They consciously or unconsciously using others. They form friendships or relationships with people who boost their self-esteem or status. They deliberately taking advantage of others for selfish reasons. Number 7, lack of empathy. They say things that may hurt others. They see the feelings, needs, or desires of others as a sign of weakness. They also they don't return kindness or interest that others show. They do not return kindness or that others show. Number 8, frequent envy. They feel envious of others, especially when others are successful. They expect envy from others. They belittle or diminish the achievements of others. Number 9, arrogance. They patronize behavior. They behave in a way that's snobby or disdainful. They talk down or they act condescendingly. They talk down or they act condescendingly. So people with NPD, narcissistic personality disorder, they may also show a fear or they avoid vulnerability. They withdraw from others to hide feeling vulnerable. They show sign of perfectionism, right? They are hypersensitive to criticism, rejection, or failure. They may experience severe depression, right, related to rejection or failure. They react to anger when they feel rejected or criticized. They fake humility to hide their feelings or protect their sense of self-importance. Lastly, they avoid situations where failure is possible or likely, which can limit their achievements. So these are all of the symptoms that people with narcissistic personality disorder, they exhibit. So what are the causes? What could cause somebody to have all of these symptoms? So it could be genetics. It could be because of observation or imitation. So children can learn traits or behaviors that can lead them to develop a narcissistic personality disorder. So another cause is a negative childhood experience. So a child who was traumatized, who was rejected or neglected, and also have lack of support can develop NPD, and it could also due to parenting style, right? Parenting style, where you have overindulgent children or overprotective or helicopter parenting, that may also lead to a child who grows to expect the same or demand the same treatment when they get older, right? Lastly, it could be due because of culture. So a culture where individualism or personal independence are more encouraged can lead somebody to develop NPD, right? People who grow up in a culture of a sense of community and collective action are less likely to develop NPD. So individualism and personal independence could lead somebody to develop NPD. So a sense of community or collective action, people will be less likely to develop NPD. So these are the causes. So what are the complications? What are the complications from having NPD? So you could have mood disorders or bipolar disorder. You could have body dysmorphic disorder. What is that? So body dysmorphic means negative feelings about your body or your appearance, how you appear. You could also have substance use disorder. So you return to alcohol, right? And then people with NPD, they also tend to commit suicide. So these are all of the complications: mood disorders, bipolar, negative feelings about your appearance, substance use, and people with NPD tend to commit suicide. So how do you get a diagnosis? You could get a diagnosis to a psychiatrist or a psychologist who would diagnose you with having NPD. And after your diagnosis, how do you manage and treat NPD? So you could receive these types of treatment. So they could do dialectical behavior therapy with you. They could do cognitive behavior therapy, metacognitive therapy, group therapy, or family therapy. So all of those 5 different types of therapy could be used in treating your NPD, your narcissistic personality disorder. So are there any medication? Yes. So you could be prescribed antidepressants. You could be prescribed anti-anxiety medications, antipsychotic medication, and anticonvulsant medication. So all of those different types of medication can be part of the treatment that your mental health provider will have put together with you. After they do an intake, they ask you questions about your life and everything, your background. And once you have that diagnosis, then they will put together this treatment plan for you, and they will have either one of those therapies, the therapy treatment in combination with all medication to help you with your narcissistic personality disorder. So again, so we went over the different symptoms. It's a lot of symptoms: grandiose sense of self-importance, frequent fantasies of having success, power, intelligence, beauty, love, or self-fulfillment, belief in superiority, need for admiration, entitlement, willingness to exploit others, lack of empathy, frequent envy, arrogance. So all of these are symptoms of somebody with NPD. And we also talked about they are vulnerable. They tend to want to be perfectionist, right? They experience severe depression. They have fear of being criticized or rejected, right? They avoid situations where failure is possible because that would impact their achievement. So that could be because of genetics, observation or imitation, a negative childhood experience, parenting style, and culture. All of that could cause someone to have NPD. And we see that there are many different types of complications. People could end up using substance abuse. They could commit suicide. They could develop mood or bipolar disorder, and they have negative feelings of their appearance, right? And again, there are many different types of treatment that your mental health provider can put together for you with a combination of medications. So this is what I had for you today on Cause de l'École regarding narcissistic personality disorder. So I encourage you to please share this live video with your friends, so that way they can also benefit from this invaluable presentation. I want to say hi to my wife who's watching. Thank you to everyone else who's watching. I thank you. Enjoy the rest of the Sunday. Have a great week. And I will see you next Sunday, and stay blessed.